um, on the Blue Care, we didn't want to call it an HMO because of that negative stigma attached to a HMO. So we call it a Blue Care product. And it embraces a different network. And if they leave the state of Florida, just like with our Medicare programs, they have emergency coverage for ER visits, hospitalization, and out-of-area renal dialysis if necessary. This policy does not require referrals. So you don't have to get a referral from your primary to go to a specialist. You don't have to concern yourself with that, okay? Just know that and make sure that you're addressing the network for someone. And because as we talk about the underwriting, after we go through some of these policy descriptions, you're really going to see an opportunity there because the underwriting is so lax compared to our standard Blue Cross underwriting. It just brings up huge opportunity for all of us to write this business. Business that pays you more than a short-term medical, business that serves a better need than a short-term medical, and issues quickly. And I will keep my eye on it. So next week when we have our call, hopefully we'll have about 4 or 5 policies that were written on the HMO already this month. And we'll have some idea of what the timeliness of that issuing is going to be and how that's going to be effective for everybody. So let's just talk about the benefits a little bit really quick. If anybody has any questions while I'm going through the benefits, stop me. The first policy that we're going to look at is going to be the 805. Remember, the 805, 806, 807, and 808 are all on this new underwriting parameter that you can embrace. Okay? But we got to know the benefits, and we do really want to lead with these policies because of the underwriting. Okay? A lot of you have said, well, I'd much rather pitch a 533. If you'd rather pitch a 533, know what you're going to deal with in the underwriting. And we all know what we've dealt with in the underwriting with Blue Cross for the last years of our career, and it's not always a warm and fuzzy feeling. That's the nicest way I could really put it. But know that if we can migrate and lead with this Blue Care, and talk about the Blue Care, talk about the 805, the 806, the 807, and the 808 in replacement of the 533 through 35. When the only time we should really be migrating back to that 533, 34, 35 is if someone is spending a lion's share of their time outside the state of Florida. And what you also have to understand is that if I am worried about when I go to Albuquerque, New Mexico on vacation, or I vacation every summer in Ortley, New Jersey, okay, I am, Jersey Shore, that's what I'm doing. I still have emergency care. I may not be able to go to my doctor because I'm not feeling well, but realistically, we just go to the hospital in that situation, okay? So when we look at that, and we look at the 805. Let's kind of go through the benefits. Now Jeff sells a ton of this, and Jeff is actually saying what a difference a couple of days make in product choices. I'm sure many of you are feeling that way because we really wanted to stop selling that Blue Care, and the reason why we'd stop selling the Blue Care, to Jeff's point, is because they are going to be forced to migrate to a health care reform plan in January. So if I identify with someone that they are going to qualify for a subsidy, then this becomes a great solution. If we identify that they're not going to qualify for a subsidy, then we can always go to the other plan knowing that they're going to keep it through the January date. Okay? So it is important to identify that. Great point, Jeff. It does, a couple days does make a huge difference. So we go to the doctor. It's still no balance billing. We are going to have a $35 copay for my primary care doctor, urgent care facility $75, specialist $65. Very much in line with what you're accustomed to with the lion's share of the program that we write being the 533. Any hospital is going to be emergency care inside the hospital is going to have a $500 copay. Okay, real simple. It does not alleviate the need for the accident plan, not trying to take away from your cash flow, but know that that emergency room copay is there. The accident plan can pay the copays, can pay out-of-pocket expenses, and can pay anything related to an accident. But I can go to the emergency room for chest pains, not be admitted, and in this situation, I've got a $500 copay. if I get admitted to the hospital, and then it is going to revert back to the per day benefit and deductible on the policy, and we'll go through that in a minute. Your urgent care and convenient care are pretty much the same thing, depending on where you're calling it. Convenient care clinics are more like like the places in Walgreens, just the quickie and dirty. They're not going to do all of the casting. They're not going to do something that more of a specialist is going to take care of. They're not doing x-rays, where your urgent care center is much more robust, shall we call it, can do a lot more things that you are not going to get done in just like a Walgreens kind of thing. Blood services are all going to be free at your independent clinical lab, at your Quest Diagnostics. If they do it in the doctor's office, they will collect a $35 copay. That's for the draw and the blood services. So keep in mind, if you're going to the doctor, you pay a $35 doctor visit for sickness. He draws the blood. They're not going to charge you 2 copays. It's just the 1 copay, and then they have to send it to Quest for testing. Very typical is what we're already used to. Basic imaging, x-rays, ultrasounds done in the physician's office, $35 copay, $65 for the specialist, $75 in an independent diagnostic testing facility. Outpatient hospital is a big thing that you have to make sure, just like when we sell our Medicare products, think of it this way, when you're looking at what the range of copays are going to be, that's where the difference is going to be here. Get those services done at an IDTF, get them done at a specialist office. There's going to be a lower out-of-pocket. Don't get them done at the hospital if you can avoid it, because your client is always going to pay more if it's done at the hospital. Advanced imaging as well, same kind of scenario, be conscious. In this situation, I usually recommend my clients, the people that we talk to get it done at an independent diagnostic testing facility such as a Rose Radiology or some place like that, so that way they get the most favorable treatment and the lowest copay. We have our hospital and surgical services are going to be very what we're accustomed to. This particular policy on the 805 is your $5,000 80/20 plan with a max out-of-pocket of $15,000 in the worst-case scenario. Okay, and that is going to be where you see this coinsurance line here. Okay, now remember, everybody, that with Blue Cross Blue Shield policies, your copays count towards your maximum out-of-pocket, not always to your deductible. So for this particular policy, as you see, your out-of-pocket maximum is $15,000. That is a per-person basis, or per family. The number is the same, okay? But these copays aren't counting towards the deductible. These copays are counting towards your maximum out-of-pocket, which is a significant difference. Remember, the rule is always your copays, even on the 533, count to your max out-of-pocket. However, your maximum out-of-pocket in a 533 is your deductible. So, moving on. We have our outpatient spinal manipulation. Again, these all have limitations on them like any other scenario, non-referral kind of program, depending on where it's done, driven by the copay is going to be lower by the location. We have the same ambulance coverage, home health care coverage, skilled nursing facilities, and mental services that we would normally be accustomed to with our Blue Options plan as well. So very similar here. What we're dealing with as well is just not going to be a 5,000 100% coverage program. But remember, they have their copays. So if they're getting services that are driven by the copays on the 805, those copays are going to count towards that max out-of-pocket. And if they did end up in the hospital as an inpatient, they would still have the responsibility of the deductible. There is drug coverage on this plan, very similar to what you're accustomed to with our 533. Tier 1 and Tier 2 drugs only. We do have Tier 3 coverage on the Blue Options plan. So that would be one of the only differences. If you're identifying a high-cost drug, then it may be something to address. And as we talk about the underwriting after we go through these plans, then at that point you'll see with that $800 maximum on the drugs, that would not be a fit for this plan anyway. You can't add maternity to this. I've heard some, I was speaking with Dave this morning, and he said, well, we can't add maternity anymore. That's actually incorrect. We can add maternity to Blue Options because they can keep it. We can't add maternity to this policy because it's going away in January. So just be conscious of that. If someone needs maternity, this is not going to work for them. But also, before you offer the maternity option, make sure you identify the availability of a subsidy for that particular person. And if they're not going to qualify for a subsidy, then at that point, you may want to just put them with a Blue Options plan. Remember, we don't know what the cost is, but for our younger individuals on the Blue Options plan compared to a healthcare reform style policy, there is going to be a significant difference if they're younger. If they're a little bit older, then not so much. All right, so that's the 805. The 806 is very similar to what we're talking about here. This is not something that you have to worry about with how it's going to be set up for odd families like an HSA. The difference between the 805 and the 806 is coinsurance. So if you are really comfortable with the 533 plan, then the 806 plan, you being able to say 100% coverage, 100% coverage deductible, then this would be a better solution for you in your presentation. It's going to have all the same style copays. The difference is going to be how much the client pays after the deductible. So a good example is going to be advanced imaging, outpatient hospital, even outpatient basic imaging. After they pay the $500 deductible that you see here, then what's going to happen is they're just going to have a copay, very similar to Medicare, where you pay a per-day benefit or a per-service benefit. So if you're looking at an inpatient hospital, for example, you'd pay your $5,000 deductible. Then after your $5,000 deductible, you'd pay $600 a day for a maximum of 5 days. At that point in time, if they re-entered the hospital and the deductible had already been satisfied, they would simply pay the $600 per day for a maximum of 5 days. That's how we get to a maximum out-of-pocket of $15,000, because these copays can keep on going until they hit 15 grand. Where if we were on a 533 and we would say to somebody, after you meet your deductible, you don't have to pay any of your copays. Well, on this particular policy, you would still have your copays and they still would be applicable. And that's really the difference between the 807 and the 808, except that's just a $10,000 deductible instead of a $5,000 deductible. And that is how the difference is on these policies. It's with the difference of coinsurance after the deductible or a copay after the deductible. And you will have to identify that with your client, what's a better feel. But if someone likes the idea of doctor visit copays for all services, then you can go to the 806. Quite honestly, the amount of the coinsurance at 20% may, in many cases, be less expensive than some of these copays. And that's something that you'll work through with your client, identify the pricing, but the difference is mainly going to be with those deductible plus the copays. But great policies, people love these. You really want to play on a couple of key features, and that's going to be that emergency room copay, the limited underwriting. It's a very good plan, and if they do leave the state, if they do leave the area, they will always have emergency coverage. And for me personally, I wrote a lot of Blue Medicare HMO this year. So if I can compare a presentation on this under 65 product with a Blue Medicare HMO, is that what are you going to get accomplished or get done if you leave the state? Are you going to go because you're not feeling good, or are you going to go because you need emergency services? I think Margaret has a question. Hold on one second. Sure.
If it's $15,000 for one person, how can it be $15,000 per family?
Because it's an aggregate deductible. This is the max out of pocket for the family is $15,000. So when they get to $15,000 max out of pocket for a family or for an individual, that's the cap. That's the done. And that's how it was always described to me as well. So if they had, if two people in the family ended up having significant situations, there's still only $15,000 max out of pocket. Where, like for the Blue Options 533, we've got $10,000 max out of pocket. So the maximum exposure is only $5,000 more than it would be on a 533. It's a little bit more for a single person, obviously, but for a family, it's still going to cap off at that 15. It doesn't really make sense. Just to make sure that I agree with you, it doesn't really make sense, but that's just how they build the policy out. And Margaret's question, for those of you that did not hear, was how does it make sense that we've got $15,000 per person or per family? They're not identifying a difference there. You have a deductible per family, which you can see here is $10,000, and then you have a maximum out of pocket per family is 15 and 15. So it doesn't really make sense, but that is just the way that it's built. Jeff's got a good comment. He says less than 3% of the American population ever reach their deductible at any given year. I would agree with that completely. And if they do reach that deductible, it's more than likely for an accident. Can you guys close the door in the conference room, please? All right. So does anybody have any questions on close? No. Keith's question was, does an urgent care facility out of network work for out of the area? And the answer is no. You're going to want to use the emergency room anytime you're out of the area. So if I'm having, if I have significant bronchitis, I go to the emergency room. If I have pain, undescribed pain, I'm going to go to the emergency room. When you leave the state of Florida, go to the emergency room. That's the big kicker. All right. So basically, I want everybody to get comfortable with these plans. In the document that I sent out to everybody, which is here the other day on the underwriting, I have copies of all 4 of the plans descriptions right here. So those are right here for you. Also, the counties that you cannot market the HMO, so you don't want to talk about them if they're in these counties. Need to make sure as well you understand we are not having a rate increase on the Blue Care. So make sure if you are talking to somebody on the Blue Care policy that you are not talking to them about the rated price that is in AutoQuote, because that doesn't apply. It only applies to Blue Options plans right now. So look at that list. This is a good idea to print this list and have it on your desk. I would have a copy of these 4 brochures as well, so you've got them handy so you know what you're talking about, because these are the products that you should really be talking about, because it is going to significantly increase your issue rate for all the people that are lying to you. Because let's face it, everybody is telling you that they're healthy, and when it comes down to it, they're really not. Right? Right. Okay. Correct. Crystal said if you quote this in AutoQuote, it will not allow you to quote these counties, and that is correct. So you don't have to memorize them, but if you're doing your presentation and you identify that the person is from Key West, you don't want to say, oh, we've got some wonderful changes in underwriting, because that's Monroe County, and you can't write that policy in Monroe County, just like Volusia or Flagler or the list of these other counties that are here. Very small list overall when you think of the number of counties that we have in the state. But again, just make sure we know that. All right. Now I really want to talk a little bit more about this list. I have, been doing some research. I've been asking the underwriters. I actually got the head underwriter to answer some of my questions that I had when it came to what we were going to deal with on this underwriting and how it was going to be handled. And I can tell you that I'm very excited to get the responses that I did. And what I was told is that on these underwriting guidelines, and I'm going to show it to you right here. This is from Patty Slappy. This is some of the questions that I had. So let's kind of go through some of these big ones. basically what you're going to see is that it is going to be on attestation of application. The only time that it's going to bring up telephone interviews is if someone has a previous file from Blue Cross. They had Blue Cross group insurance before. They had a group insurance or an individual policy, or they were recently declined from Blue Cross. And that's where you could get yourself into a situation that you would still have a decline. Remember, uncontrolled conditions are still a decline. That's also something that you have to be aware of. But remember that it is on attestation of application, and when the client, if they do a telephone interview with the client and, it is controlled, it's controlled. So you have to make sure that you understand that. So one of the questions I asked is, are they going to have abnormal test results? That's still going to be declined. Are we going to have a 300% rating on children? In some cases, it's either going to be 25 or 300. So if you mess up the weight on the kids, if you put them a pound underweight or a pound overweight, you're still going to deal with that 300% rate up, and we're going to have to fix that up. Big one, smoking and asthma. Is that a decline? And the answer was no. Okay? The answer was, if you are a smoker and you've got asthma, so you can't breathe and you smoke anyway, normally that's an auto decline. That is a 25% rating. Fibromyalgia, 25% rating. When we talked about complications of pregnancy or fertility treatments, those are both declinable conditions, 25% rating. So we have a lot of different areas that we can talk about. We talk about high blood pressure and weight, high blood pressure and smoking, high blood pressure, cholesterol, and smoking are not declined conditions. What you have to be conscious of as well is mental or nervous disorders, not a declinable condition. As long as their drugs are less than $800 per month, then we're going to be good to go. I am personally putting in an application today for somebody that we work with, mental or nervous conditions. Guy takes about 4 medications. He's probably somewhere around $600 a month on meds. He's not worried about the medications. And because of his anxiety, his ADD, those don't fall under here. He's going to be issued at a 25% rating. Bipolar disorder, not on this list. So if you get someone on the phone who's a little bit bipolar, it's okay now. So you've got to print this. This is a 3-page list. This is the list that you need to access and look at and keep your eyes on, because honestly, we are so accustomed to saying no with Blue Cross for so many things. This is changing the mindset. Okay? Sleep apnea, somebody asked me about the other day. It's not on this list. Write it. There are, obviously some big ones that we, as we look at the diabetes, okay? Everybody's asked me about the diabetes, and then the diabetes is not going to be covered. The Blue Cross released an underwriting guide for diabetics, a diabetic underwriting guideline, which showed that you can have no other condition. You have to be taking less than 500 milligrams of metformin on a monthly basis. Nobody who is diabetic, thinks they're diabetic, borderline diabetic, is taking it less than that. Borderline diabetics are not diabetics, so therefore they can be written, because borderline is borderline. That doesn't mean that you've got it. COPD, moderate or smoker, that's still going to be a decline. As we look at what came up the other day was some liver problems. We'll kind of touch on that a little bit. But these are the really big ones. I mean, if your client's got rabies, you're going to have a problem, okay? DUI, multiple violations within 3 years. 1 DUI is okay. 2 gets a little touchy. 3, stick a fork in them, forget it. That's not going to work. Endometriosis, believe it or not, is still a decline if it's present or within 3 years. That's one of those weird ones. On a PPO, endometriosis is going to be a rider. We can deal with that. But on the HMO, that is going to be a decline. My advice, print a copy of this. Keep it on your desk. Talk to your clients. Don't be so quick to say no. Now reference this list and make sure that you're talking to someone about the HMO product if it's available in their county. don't stick a fork in yourself by pitching this product before you identify the county. So if we go through the presentation, hey, how you doing? This is who I am. This is where I'm from. This is what I'm talking about. Where are you from? Where do you live? That really has to be your first or second question. Because if you don't even want to present this policy. You want to identify the income first and talk about healthcare reform, that's fine. But before I say, I've got a solution for you, before you even get into the medical, find out where they live and if they're in available county. And you could do that simply by having this printed up and having this on your desk. So really important to make sure that you're addressing these concerns, making sure that you're comfortable with this product, and leading with it whenever you can be available. You're talking about taking your placement rate, which most of the placement rates are under 70% outside of a select few of you, and getting that number well over 85%. That is the difference. Also, a couple of people have asked me, well, what about short-term medical? Short-term medical still serves a place, but be conscious of it, because how many people do we talk to that are looking at a short-term medical product that say, well, I want to have doctor visits. I want to get my checkup. I know there's only a few months until healthcare reform, but I still want that stuff. And rightfully so, they deserve it. They should have it. If they can afford it and they can qualify for it, we should write them the HMO. You're going to make more money. It's better all the way around. You're going to have a happy client, and then all we do is we transition them in December or January to a healthcare reform plan, obviously before January 1st. So December or November to a healthcare reform plan. There will be a rollover commission that's going to be being paid based on a transfer to a healthcare reform product. No chargeback. You get paid twice. How much better could that be? I mean, thank you, Blue Cross. So, I'd like to know if anybody's got any questions, because I am really excited about this, and I think that everybody just needs to understand the gravity of what this means to all of us. No questions at all? Wow. Okay. The office in Tampa will have very limited staff on Friday. There will be no admin staff here. So I know that some of you will be coming in. Those of you that do need to come in and use the office, you need to make sure that you get with someone today, or you get with me on Friday morning, so that way you have entrance into the office in the form of a key. So make sure that we've got that set up for you. Also, I want to remind everyone that there is a schedule posted in the conference room for meetings. If you need to schedule some meeting time, make sure that your name is up on that board, and please make sure that that's done as well. I also want to introduce we all have a new young lady working in our office. Her name is Virginia. She's awesome. I got to tell you, she's really good. So she just started with us. She's helping with a lot of administrative duties. Introduce yourself to her if you have not already. I think that she's going to be a great part of the team, so really excited to have her. And lastly, we all need to congratulate Michael Planis when you get some time. He will be getting married to Jamie, that's right, on Saturday. So very good for Michael, and Eddie's going to be a little upset because he's off the market, but these things happen. So I want to thank everybody for their time today. I hope everybody has a fantastic 4th of July. And if nobody else has any questions, I want to let everybody go and say thank you, and have a great weekend, everybody. Enjoy yourself, because we are going to really be rocking and rolling starting next week, and be safe. If you drink, which I know most insurance agents do, don't drink and drive. All right, everybody, have yourself a great day and a beautiful weekend. Bye-bye.